Let's get started with day 3 of week 2. I'm pleased to welcome back Dr. Jose Mayorga. For those who weren't with us last year, I want to offer his bio just so we know and he can set the stage for who he is and how he comes to this space and talking about the intersection of the COVID-19 pandemic amongst Latinx folks. So Dr. Jose Mayorga is a board-certified family physician leader with extensive professional experience in the for-profit and nonprofit sectors. He has dedicated his family medicine and administration career to providing high-quality care to the medically underserved. Dr. Mayorga's career began in 2008 as a per diem physician. He later opened his own private practice, was a site medical director for Ultimate Health Services, and later became the chief medical officer for Share Ourselves Corporation. Later, he served as the IPA medical director of Healthcare Partners, a division of DaVita Medical Group, now Optum. Since 2018, he's been the executive director of the UCI Health Family Health Centers and is faculty in the Department of Family Medicine at UC Irvine. He's also an assistant clinical professor here at UCI. He leads the UCI Family Health Centers, the oldest FUHC in Orange County, as their CEO and CMO. And he's excited to return to the clinic where his passion for underserved medicine began as a student 23 years ago. In the FQHC, it cares for nearly 24,000 patients who are predominantly Latinx and monolingual Spanish. 99% of the patients live below 200% of the federally poverty level, and of those served, 32% were children. He believes strongly in the power of the safety net network and believes it's the best kept secret in healthcare. He's committed to making community health centers the medical home of choice. He's not new to the lecture space, especially on population health and social determinants of health. And during the COVID-19 pandemic, Dr. Mayorga has been a leading care innovator to ensure that underserved communities have the same access to care. He has served as a COVID-19 medical expert in Spanish and English media outlets and town halls across Orange County. He looks forward to teaching future doctors of this country and hopes to empower them to become leaders in primary care and advocates for health justice. Welcome, Dr. Mayorga.
Thanks, Kelly. I love talking to the group, and I'm so happy to see a lot of the same faces and names joining us. I know I was a little concerned because I gave you guys 2 lectures earlier this week. So again, excited to be with you all. This topic is obviously huge. It's ever evolving, and I'm excited to share some interesting things I've shared with others, as Kelly mentioned, throughout this past year. And so we'll start off by making sure you guys can see my screen there. If you do have questions in the chat, the team will let me know, and they've been really great at monitoring the chat for me. But really, again, this is such a massive topic to cover in just a finite amount of time. But all that being said, I am going to go through a few things. We're going to give you a general overview. We're going to talk about where we are, as well as talk about the vaccine efforts. And then, of course, we'll talk about the impact on the Latinx community. And really, you could probably extrapolate that in other disenfranchised or underserved communities. So I think it's really important to kind of put it all in context for you. And also, I'm going to kind of give you a glimpse of what some organizations have done to really try to close that healthcare disparity as we've kind of walked through this pandemic together. So a lot has gone on. Where are we now? So, the team organizing this lecture were saying, Dr. Mayorga, get us the lectures quickly. And I was like, well, this is like evolving every day. The data and the statistics change every day. So you can see there back on April 13th, just about a week ago, where we were. Extremely humbling situation, right? Over 136,000 cases globally, almost 3 million deaths back on April 13th. And I think really, I need you guys to take a pause here for a second. First, remember this. This is probably underreported. Do not forget that there is probably people out there that succumb to this disease or did not go and get tested. So these numbers are absolutely conservative. Don't let this fool you. The other thing I want to draw your attention to that's really disheartening, the US loves to talk about being #1 across the world, but this is a first place position we never wanted to be in. And so there is a lot of disheartening things happening throughout this pandemic that put us in this position. And of course, I'd be remiss if I didn't say it got politicized, something that us in healthcare never thought we would have to be faced with, having to explain to some of our patients, maybe even some of our loved ones, why it was important to take the warnings from public health experts. So again, it's very, very disheartening to see these cases, and they continue to rise, right? They continue to rise, and we see this. So the other thing I wanted to show you kind of from a global perspective, now let's talk about the US, right? So in the US, they talk about different surges. Here in California, we felt really just two of those surges. But what health experts thought and did happen when the pandemic hit us in summer, we knew that the winter was going to be 2 to 3 times worse. We were all collectively trying to convey the message, all the needs of public health measures, social distancing, masking, in some cases, unfortunately, having to close down things and participation, yet we still got hit with such a massive spike in cases in the winter months. People that I had the pleasure of working with worked literally 7 days straight. We literally at UCI Health put up a military style tent in the parking lot in a matter of less than 14 days that could take care of about 100 people. That's simply because we were at capacity. We were at capacity in the physical, brick and mortar building. So, something we never thought, at least in my lifetime, never thought I would ever see, but we did. And so I put up there, is there a fourth surge nationally coming our way? Well, as you may have heard from some of the more famous experts out there, we have plateaued in a state that we probably don't want to be. That number is still a little high, and it makes us very uncomfortable. What you're seeing happening back east can make itself west. The only thing that protects us here in California is the weather's nicer. I think that's one thing. The other piece is everything gets delayed, right? Remember what's happened. First, we saw a little bit of a surge coming up again in Europe. It hit the East Coast because the weather was still cold. It's hit some of the Midwest because some of the changes the governors have made in some states. And again, we should not put our guards down in the sense of thinking we're all in a good place given all the vaccine is circulating. There's still a large percentage of people not vaccinated, but we'll go into that in a few minutes. So from my perspective, in my opinion, can there be another surge? They could be micro surges, and we'll talk about what that means in a moment. Now, this is something also that's more humbling to me, being a California native, and some of you may have been born and raised in California yourselves, but being in the top 5 is not a good situation. Being in the top 10 is also not a good situation. So of the 5 Southern California counties, those sit in the top 10 counties of all COVID-19 cases. Yes, there's more people that live here compared to across the country, but the reality is, the people that have been inflicted by this live in very unique locations within these counties. And that's what we're going to spend a lot of time talking about in a moment. But again, not something we want to take a lot of pride in being in California, specifically in Southern California, because we are in the top 10, and this will likely continue just given simply population. So a lot to work to be done. Now, more locally, since I'm sitting in Orange County, this is the people that we serve. These are the clinics I oversee. There's definitely good news. I mean, you hear about cases being extremely low, ICU capacities being available now. We're not as worried. We did well, but there were certain pockets of the county that did not do well. And I think that's where I'd like to kind of share with you for later on in this presentation. So just a few months ago when I was giving this lecture, I wasn't able to show you this slide. So this is literally fresh off the press. This is a day-old data from world data of vaccinations, total vaccinations, right? These aren't total fully vaccinated individuals, but these are total doses administered across the world. And so, being in first place in the US is actually a good point in this case. But I think the other thing I want you to appreciate is just from the last week when I put this presentation together, just to give you perspective, April 13th, we only had vaccinated or administered 189 million doses. And look where we're at as of yesterday, over 213 million. A lot of vaccine is being administered, about 3 to 3.5 million doses a day. And so really exciting. The other perspective I want you just to ponder for a moment, and you're starting to hear a lot about this in the media, and maybe even had conversations with friends, is, yes, the US is leading the way in vaccinations, but what about other countries that may not have access just yet, or may not have such a robust immunization program amongst their communities? That's something we really need to start thinking about. If you hadn't heard, the administration here in the US did dispense or sent out vaccines to other nations, particularly that we're currently not using. But I think that's also the reason why you've heard that we are also acquiring a lot more vaccine, not only for our own population and for those future individuals that will likely become eligible for vaccines. And I'm speaking about those less than 16 years and older here in the US, but likely, I wouldn't be surprised that we will start being the leaders again in the world and starting to push out more global health efforts to try to combat this pandemic. It's already been demonstrated by the push to put us back into the WHO. So let's talk about what's really the premise of this conversation. How has COVID-19 really impacted minority communities? And in particular, how has it impacted the Latinx community? Now, let's take a trip back in history for a moment. When this pandemic first started, the folks that were being identified as becoming sick, or at least demonstrating a positive result for COVID, were people that had access to testing, people who have gone internationally or traveled abroad across the ocean. Some of the early cases, as was documented in Orange County, were from people that lived in Irvine. There's some suggestion from some other UCs and experts that COVID was probably more around us than we thought, probably around late November to December, when again, testing wasn't readily available. Actually, we're still trying to figure this out. And so, really kind of, we were behind the 8 ball, so to speak. We were behind the process, but yet these cases were already spreading within various communities, and in some communities more than others. And so really, for me, as we go through the remainder of this pandemic continues to demonstrate the healthcare disparities and the healthcare injustices that we see among certain communities that have struggled just in general with health for probably their entire lives and in their generations. So let's talk about some national data. Okay, this is national data, the CDC information. And you kind of see, what I've kind of boxed in red for you, just to show you some comparison. Again, we're going to focus on the Hispanic and Latinx populations here, but deaths up to 3 times more likely, 4 times more likely hospitalized, and almost 2 times more the cases. Very, very impactful when you compare that to white communities. And of course, other minority populations were just as afflicted by this as well. Here in California, absolutely these numbers still hold disproportionately. Latinos, Latinx people make 39% of the entire population of California, but yet 56% of the cases of COVID are within this community, and 47% of deaths are within this community. Those are some big numbers to just kind of appreciate, and unfortunately here, given the situation that we're still in, and still trying to encourage people to get vaccinated. More locally, in Orange County, the Latinx community makes up about 35%, but again, consistent with California's data, about 40% of the cases are of Latinx community, and of deaths, about 38%. Again, very disheartening, very challenging for a lot of us. And so what about these cases were so unique? Well, the most densely populated cities in this county are in 2, Anaheim and Santa Ana. And it's no surprise that the majority of the people that live there are of Latinx descent. And so this is, again, very, very impactful. So I'm going to share with you a personal story. And I think this was kind of one of those moments in my year of COVID that really, really struck me. And this was early on when I was, the school year was just starting. And my wife and I decided to keep my oldest daughter in a hybrid model. We were fortunate that her public school was going to do part-time virtual versus in person. And so as I was in the middle of just planning for these surges, dealing with this, one of the most disheartening things was driving past her school and seeing my own neighbors, I would call, because this is literally blocks away from my house, walking all their children, literally hundreds of people walking on the street, and very few to none were wearing masks. All the while I was headed into work, into this very clinic I'm sitting into, knowing the rise of cases that were dramatically impacting the patients we served. And why do I share the story with you? It's because this county has very unique demographics, very unique cities. And as my prior talk, we talked about population health and how the zip codes of where you live really influence your overall health. Little did those people know, where I have my child going to school where I live, of the immense amount of impact this pandemic was already having on these two cities where the clinics I oversee reside. And so that was, again, very, very impactful to me, because it hurt. It hurt a lot, because I wanted to make sure people knew that if this pandemic was in one city, it's easily in all of our cities, in all of our counties, but sometimes it was just really hard to convey that story to them because they don't see it. And so again, it was a challenging situation. And so as it pertains to these cities, why is it, right? Why was it afflicting these two cities the most? Well, it comes back to being just a disadvantaged space that they live in, right? These cities are densely populated cities. People within these cities were essential workers, right? They called healthcare workers health heroes, but really, to me, the real heroes are these folks that were making sure our grocery stores stayed open, making sure our produce was there, making sure that all of these things were available for us to continue to literally survive during this pandemic. They were essential workers. And so what happened early on, folks didn't abide by wearing masks, so people were getting exposed while at work. They may come down with that infection. We saw this in our clinics. Patients would come in, they'd come in and they'd be sick. They would work for someone that didn't provide sick leave. And so what did they choose to do? Either put food on the table and continue to work, or stay home. Either choice was a challenging choice, because if they stayed home, their living constraints might be challenging, in which they may not be able to isolate themselves. Maybe they shared a bedroom. Some of our patients literally share a bedroom with like 4 other family members and only have one bathroom. So me telling them to isolate themselves or try to segregate themselves from their families is a daunting task, because they couldn't do that. And so this is why these communities have been so dramatically impacted. And if you look at the other data set within this slide, a lot of them live in poverty. A lot of them live in multi-generational households, like I mentioned, and it's really a really impactful thing. And what do we know at the end of the day? What's tied to health insurance in our current makeup of our healthcare system is financial. Financial resources really drive our ability to have access to care. So the reality is these folks were already set up to have some challenges facing them with this infection, simply because they may not have routinely see a doctor or have their chronic disease managed correctly. So again, very, very impactful. So I call these the social determinants of the Latinx community, because these folks that were working really were always out there making sure that things continued and function. There's some data from the US Bureau of Labor Statistics that shares only 16% of the Latinx community can work from home, 16%. So it was no surprise that, for example, where I was driving from my house to work, that some of those people didn't realize because they were probably working remote. Or maybe you yourself know folks that work remote. You yourselves as students were remote, right? You could isolate yourself, you could protect yourself. These folks had to go in and work. That's simply because that is their space, that is their environment. And so the other thing that comes from this is their overall lower paying jobs, right? So they may not have those resources. So if they're in the food industry, if they're housekeeping, janitorial, construction workers, they may not have some of those resources. So again, the widening of the socioeconomic gap truly impacts these folks more than others, and other poor communities that really were on the front lines, in my opinion, making sure the rest of us were okay. So how did we respond? How did our health centers particularly respond? So think about this for a moment. The two clinics that Kelly shared that I oversee take care of about 24,000 patients. Those 24,000 patients predominantly are monolingual Spanish, are Medi-Cal recipients, so they get their health coverage through the state and the government. But the other thing is that there's some health literacy. There's some health challenges already facing them. And so what we decided to do was to ensure, first and foremost, we have to provide them the access to be able to get tested, right? We wanted to know if they themselves had succumbed to this. So we popped up our drive-through testing site physically in the hardest hit zip code here in Santa Ana. I was taken aback during the second surge that our positivity rate hit 58%. 58% of the tests that we were administering came back positive. And so imagine that volume of patients having to manage and guide through the rest of their diagnosis and prognosis, ensuring to activate the teams. And so literally, in order to protect them, protect others within our clinic, we converted to virtual care. And for most part, virtual care, via however you call it, if you call it telemedicine, telehealth, literally it's virtual, right? They're not physically in your clinic. But here's a population that doesn't comprehend very well, or may have some, challenges with the internet, may have some computer literacy. So it was our job to try to educate them and empower them that yes, you can see us via phone or video. We will try our best to give you the same care. And if we needed you to come in, we will do our best to have you come in safely. And so those are some things we activated. But the other thing, which was really important, in order to even get them to that point, we had to make sure that we provided the right education and materials so that people understood simply how to access this information. Now, fortunately, most of our patients had some level of a smartphone, but for the most of them, they would not even activate their video process. We would be doing a lot of this over the phone. So in addition to that, a lot of our more frail, chronically ill patients, we wanted to make sure we knew who they were. We wanted to identify them and continue to manage them carefully and safely from home. Again, 58% positive right outside this door. And so we decided to invest as much of our resources to start mail ordering their medications. Medi-Cal doesn't actively do that. They don't have a mail order program. So we decided to start mailing out their medication so they didn't physically have to come in to our pharmacy to get their medicine. And so we try to convert as many people to our own pharmacy so that way we could actually mail their medication safely to their homes. The other thing that we did, if they had to come in, we thought a little creatively. We thought, well, restaurants aren't open right now. Restaurants use those like random little pagers that I'm sure all of you at some point had. I don't know the last time you went to a restaurant, but that they give you, they hand you, you could go away and they'll buzz you when your table's ready. Well, we use the same technology to be able to safely keep our patients out in the parking lot so that when we needed to call them in and they're ready to go, they came right upstairs or right directly to to the area where the MAs would greet them and bring them back quickly to the exam room so they wouldn't be exposed to other folks. So that's kind of what we did. The other piece that was really, really critical, and I think this doesn't get a lot of attention, although we know that it's really important, is the anxiety, the stress, and the depression that this pandemic has caused, or put people back into active depression and anxiety, is immense. And so what we made sure we did is we queried as many of our patients who had already that diagnosis, and we actively had our licensed clinical social workers calling them, making sure they were okay, to just, again, ensure that they didn't need additional assistance. Many of these patients shared with our LCSWs that they were thankful that they were able to talk to someone, because some of them hadn't even seen their family members in a long time. Some of them obviously lost family members due to this pandemic. So they just were grieving and trying to go through this process of, now am I sick because I just saw them a few weeks ago. And so there was a lot of really interesting dynamics that came from all this as we were reaching out to patients proactively rather than reactively. And so the team did really great. We provided other resources. In addition to food insecurity resources, we also provided some housing resources that the county had established. And believe it or not, we did dental care virtually. Now, if you ask me, I'd love to go to the dentist and not have to have them stick a drill in my teeth or do anything, but we did do virtual care. We did virtual dentistry, which was absolutely great for some of our patients. And if they needed something acutely, of course, we had them come in, but that was a resource that we wanted to continue to offer, a service we wanted to share with patients. And so, you know, it actually was something our dentist was very excited to roll out. And we were able to do not only for our adult patients, but we also did it for some of our pregnant patients as well. So again, really exciting stuff that we were able to do collectively, all in response to this massive influx of positive cases within the community that we care for. Questions so far? Are we doing okay? All right.
We're doing good so far.
Okay. So where are we? What's the next step? Where have we been? So let's talk about the vaccine. So I'm going to give you some vaccine 101 education, but I think, you know, I'm going to try to put it in the lens of what we're seeing and what we're doing on the ground as well. And so are there vaccine options? Absolutely, there are vaccine options. We've heard of them. They're all over. There's different types all over the world available. Here in the U.S., we actually have, you know, have emergency use authorizations for 3, which is, you know, the Pfizer vaccine, the Moderna vaccine that are mRNA based, and then the viral vector vaccine, which is the Janssen or the Johnson & Johnson vaccine that also got emergency use authorization. Now, of course, you know, in the midst of preparing this, you know, we know that there's a pause on the J&J vaccine. My suspicion is before the end of this week, experts will probably, the ACIP, which is the Advisory Committee of Immunization Practices, will probably make a statement and allow us to restart its use with some recommendation. They've already started using it again in Europe. But in general, these are the vaccines. And I think that the biggest thing when trying to convey how and how did all these come to be so readily available, or how did we get here so fast, that has been probably one of the biggest stories and the biggest conversations to have with many people, especially those who are in underserved settings, because they frankly may not have a full understanding of just the science behind vaccines, but more importantly, there, as many of you know, there's a lot of predated challenges that the communities have had with vaccines that may have left a negative experience passed on from generation to generation. So these are the vaccines available. Happy to answer questions if you have about those. I think the other piece, because this is ever evolving and because things are ever changing, you know, we know that there's variants, we know that the virus changes and mutates. And so we know certain vaccines have still shown efficacy. The challenge again, right, because we're living and breathing these changes. How do we tell the story? how do we educate our communities, specifically those that have literacy challenges and difficulties comprehending how science, how health, how it all works. How do we ensure we're giving them the information enough to not confuse them, but to allow them to trust that we are giving them something that's going to protect them? That is the really key point. So we know who should be getting the vaccine at this stage. Everyone over the age of 16 is available. I think the biggest piece where I've spent a lot of time also talking with parents in town halls, in school districts, English and Spanish, really trying to share with them that even though you've gotten infected, you should get this vaccine. And so that is a huge challenge for a lot of people to comprehend, because they're like, well, I did okay, I shouldn't have to worry about this. But again, really explaining to them the complexity of their natural immune system may not be sufficient, even though they survived in their eyes this infection, or didn't succumb to it like maybe a relative or a friend did. And so, having to convince them that this is the right thing to do is also very daunting and challenging. But yet we continue to move on. Many of you know that vaccines are readily available now. The other piece that a lot of our patients tend to ask us is, can this make me sick? What will happen if I do feel symptoms? How do I respond to these things? So again, the natural education of talking to people about just these last three questions I shared with you in this presentation have been a huge eye opener for me, as well as others in this space, to ensure that we share the right message and we encourage people to proceed with getting vaccinated. Many of our patients ask us, can they stop wearing a mask? When can they do that? The reality, just like I tell them, and I'll tell you, we can't do that just yet, because there's just still a very contagious infection. What we should be very mindful of is, yes, we're vaccinating a lot of people, but yet the vaccination percentage combined with the overall folks who've been infected may not yet be at that herd immunity state. And so we have to be very mindful. And this is where it gets really important to share with communities, especially those that have been dramatically impacted, is because this is an identified seasonal infection. Even though the pandemic hit us in summer, we know, given the family that this is part of, the coronavirus family, the likelihood that this will come back is going to be aggressive in winter if we don't get people vaccinated. And who are going to be the highest risks are those communities who've been disenfranchised or not gotten the vaccine in a timely manner to develop that immunity. So it is a race against time. It is a race to try to beat that winter that we will be entering again in the upcoming months. What worries us in the healthcare space is cases are falling, right? I shared with you, you saw the Orange County data. It looks great. Now there's this hospital capacity. Everybody's out and about there. Everybody wants to go back to normal. The thing is, we hope it doesn't cause people to become complacent and not get the vaccine. This is why so many people are pushing really hard, and all these vaccination sites are popping up left and right, simply because we want to still keep that momentum. We want people to be excited about getting that vaccine. In the end, hopefully to decrease the outbreaks and deaths in the future. What I call, again, the micro surge, surges that can happen and will happen if we can't get certain communities vaccinated in a timely manner. The other things that most people ask us about is like allergies and should I get it? This is a great, conversation, and you hear about it in the media, because the media is very powerful, as we know. Social media is very powerful. And so really putting everything in context is extremely, extremely important. And so I encourage you all to really become familiar with not only this information, but other information around COVID, as you yourselves could help champion and educate folks. When you put things in perspective, because early on, everybody was worried about this anaphylaxis, issue. But if you just compared that to the anaphylaxis that penicillin itself causes, which is something that's readily available, people use all the time. In certain communities, people, share their penicillin prescriptions with others simply because they happen to have an extra vial of antibiotics in their medicine cabinet. But yeah, I mean, just to, again, putting things in perspective is really important. And ultimately, no one has died from an anaphylaxis reaction due to this vaccination efforts, simply because we've had pieces in place to make sure that we can respond to it timely. Again, this is something that comes up that we've faced. So I gave you that broad overview, but let's take a trip through just the overall vaccine administration efforts that have been going on. Now, this next slide is really busy, and I apologize for that. But I want you to take a look at the CDC data with me, because it really breaks down and unfortunately, once again, highlights something that we haven't learned in a year, that we may not have learned in decades of health, which is, again, minority communities are dramatically being disenfranchised, and the healthcare disparities still reign true. And so, when you look at the administration of vaccines and those fully vaccinated, you could tell there's still a huge gap in certain communities. The communities themselves have been most dramatically impacted by this pandemic. Now, it always looks great to have thousands of people lined up to get vaccinated or opening up vaccination sites. And I know this for this to be true. The first vaccine, administration sites really were located in areas where they knew that they were going to get a massive volume of individuals coming in. And so that in and of itself doesn't surprise me that the majority of those folks were not of minority communities, they were of more affluent areas. But again, very disheartening to see just the numbers that still kind of, that gap that we still see. And so, when you look locally in Orange County, now you see across from going left to right, Asian, Pacific Islander, Black, Latinx, Hispanic, and then white communities. I highlighted just the data so you kind of see. So again, the population, right, in Orange County, 35% of the population in Latinx, only about 5%. Been vaccinated, and then compared to white communities, there's your delta, there's your difference. Again, not keeping true with what the CDC is showing. Again, very disheartening to see. As it pertains to 65 years and older, right, the most at risk at least from an age demographic standpoint. Again, data is dramatically different between Latinx and white communities. And so these are the struggles, these are the challenges that we're faced with and others are faced with as it pertains to getting people vaccinated. Reese, we have a question?
Yes, our first question just came in. It reads, what are other proactive actions at the medical group and community levels that can help facilitate getting our Latinx patients vaccinated?
I love that question, and we're going to get to it, but I'll answer part of it now. To me, what it all comes down to is trusted partners, trusted individuals to help us get the word out. Now, I'll share this with you at this moment. When my parents are older, and my mom is not very technologically savvy, but what she knows how to use is Facebook and Instagram. And the minute she got her vaccine, I asked her, Mom, do me a favor, post your photo of you getting your vaccine so the entire family across this country and in Mexico could see you. And what happened after that? They immediately started asking her tons of questions, but I took the opportunity to educate my mom and give her the insight, because none of my relatives called me and asked me about the vaccine. They all called her and they're like, Thea, tell us about this. Tell us about the vaccine. How do you feel? Are you growing another arm? Are you losing your hair? Did your teeth fall out? Literally, those were the questions that she was getting asked. And I told my mom, please do me a favor, explain to them. And I gave her a very simplistic, Spanish education. I was like, please share with them. And then I started getting some phone calls from relatives and asking me about it. So again, when I say trusted partners, I'm not talking about a famous movie star or sports person. I'm talking about trusted people that look and sound like them, preferably a family member. Those are our huge champions. So that's one way we could help. And we'll talk about a few more in a moment. Other questions, Ruth?
Not at the moment. Thank you.
Yeah, no problem. Okay. So in general, when you look at, this is the last slide, which again, showing the disparity, and unfortunately, less than 65-year-olds, and this data is about from April 4th. The data was been updated April 11th. It barely moved. It was slightly a movement, less than 1% across both the vaccinated numbers here. But in general, you still see that disparity, right? You still see that Latinx community is still behind. I will argue that younger people within the Latinx community are dying compared to those with the same age group, right? Compared to white, again, simply because of their overall health makeup that they've struggled with since years before, as it comes to social determinants of health. So all this kind of highlights, right? Healthcare disparity continues, which is really, really challenging. And so one of the things that I really want to emphasize is why did we see this, right? I think you all know this, but I have to highlight this again, because I'm going to present to you solutions of what we are trying to, address this vaccine disparity, this vaccination challenge that we're faced with. So first of all, the use of technology to provide access to care benefits the masses. But in general, let's not forget that it also disenfranchises those that don't have access to technology or have technology literacy challenges. And in particular, I shared with you my mom. She knows how to use Instagram and maybe WhatsApp, but she doesn't know how to, punch in information into a website, let alone once that website starts asking for specific information like your address, such as maybe your social security number, all things that could present some challenges, not only from a safety standpoint, like why am I putting a social, but more importantly, what if I don't have a social security number? So those are some things to kind of think about how this rollout, mass vaccination rollout came to be. We definitely vaccinated those who were able to sit at home and hit refresh on a website. But yet, the same community that I'm faced with caring for, they were essential workers, right? They were not able to help their older relatives sign up because they had to go to work. They weren't working remote. The other challenges that we have as it pertains to disparity is just education, right? I just mentioned some examples. Literally, I had relatives asking my mom, I heard these vaccines cause cancer or make you infertile or make your teeth fall out. I was taken aback with all these myths that were coming out about the vaccine. And so that generally just developed some hesitancy around things. My personal take is maybe there isn't vaccine hesitancy so much as we think, because if we do it right, we could educate people, but the issue is how do we get it to them? How do we actually vaccinate? So really, as much as I love technology, as much as I embrace it, I think to some extent, we still need the grassroots effort. And that's how UCI Health, particularly our health centers, have worked within the community. So we partnered with school districts, specifically the Anaheim Unified High School District, in collaboration with the county healthcare agency, as well as ourselves, to target and really try to vaccinate as many of the members hardest hit, especially those essential workers. We reached out directly to a lot of these supermarkets that are ethnic based to invite them to come to this vaccine initiative and this effort. And that partnership really makes the difference. So it's not just us at UCI Health driving this, but it was really pulling all the levers, all the collaboration together so that we could actually get these people registered. Is it a lot of work? Absolutely. Is it worth it? 120% it's worth it, right? Because in the end, we're going to get these people vaccinated and protected. And so really, again, it's a huge grassroots effort. From our perspective, really educating people, having them appreciate and understand why this is important in a language that they understand, in a manner of simplistically that they understand, is really, really important. And I think that to me makes a huge difference. And I'll say that outreach effort, that education comes best with someone that they know and trust and love that have gotten the vaccine. Just like my mom convinced several of my aunts and uncles to get the vaccine. That's how I hope to see some of our patients who I've had the pleasure of speaking to also encourage their loved ones to get. Because in the end, we want to prevent this continuous pandemic from going on and losing unnecessarily our loved ones too soon. And so in the end, I think really from our perspective, having been here at UCI Health and seeing the immense amount of energy and effort that we all put in to respond to the pandemic and ultimately recover and reimagine how we deliver care is really important. But what I take most pride in is the teams that I have the pleasure of working with every day really took it on to another level, and they realized how important was it to be able to close that healthcare disparity, even in the midst of such an immense once-in-a-lifetime experience. So happy to take questions at this point. If there's anything related to COVID, I'll do my best. Hopefully I already answered your questions about if you could lose your hair from the vaccine. So
I hope you all understand how COVID actually is one of the more perfect petri dishes, if you will, for demonstrating our nation's societal ills and the holes in our healthcare system. It's a really interesting case study, if you will, for how racism, classism, xenophobia, anti-immigrant sentiment can become very apparent in healthcare. These statistics are unfortunate, but I love that we ended with a glimmer of hope, especially in how we've managed to get vaccines in arms. I know President Biden just celebrated a milestone of how many vaccines we've been able to give in the United States. So if people have questions about the pandemic as a whole, I'm positive Dr. Mayorga can pull from both his leadership and clinical experience to answer them. If you have specific questions at the intersection of the Latino community, the Latinx community, we welcome them. But generally, I think this is a really necessary angle for us to understand, especially as providers in Southern California, because no matter what specialty you end up in, you will interact with Latinx patients, period. You will be a provider for Latinx communities if you're practicing in the state of California, period. So I think it's really good for us to understand these issues, especially for myself as an ally. I haven't seen any questions come in yet, but did you have any other commentary here, Dr. Mayorga?
Yeah, I think there's a lot of strength in pulling on people's specialties. And what do I mean by that? So here we are, we're an academic institution. We will argue and say that we have the leading experts here in Orange County. What our strengths are that to bring to the table, maybe are even our operational strengths and mass deployment. And I will say, being an academic institution, we were able to obtain vaccine at a faster rate, at a higher volume than other institutions. The other thing that was really important is to leverage those partnerships, because the difference is that we don't have as strong relationships and ties as some nonprofits do here in the county, who are part of the community, who are great advocates for their community. And so really linking those two together and drawing on our strengths and specialties of power, the power behind that to leverage both sides of those houses coming together really makes a huge difference. none of us should be having to go at it alone. I am not an expert in certain things, absolutely not. But I know, and I'm humbled enough to ask for help. And I hope that's also something folks, today realize, that you all will become experts in whatever field you so choose, or whatever field you're currently in. The reality is there's others that can help you with your overall goal and your mission. And in this case, as Kelly has said, this is a living, breathing healthcare disparity. I hate to say 101, 201, whatever you want to call it. And so it's shown that our health system is broken. It's shown that we have an opportunity for change. And my favorite part about what the vaccine has demonstrated is that we've removed the barrier. We've removed the barrier to access to a vaccine. In other words, I don't have to pay for it. I don't have to have an insurance. I don't even have to be a legal resident to get that vaccine. And so what wonderful example of removing that barrier so that others and all people can be protected from such a debilitating and dangerous infection. Other questions?
Dr. Mayorga, can you hear me?
Yes, I can.
I have one question. I was wondering, you kind of touched on how to kind of connect your patient to their community and kind of encourage them to discuss with their friends and family if they have questions. What if the friends and family, I feel like in my experience, sometimes the friends and the family are the problem and are kind of spreading some misinformation. So in that situation, how do you as the provider encourage them to look for other resources?
Yeah, it's one of the things I put a lot of thought into is that. The other thing I also put a lot of thought in is those folks who, let's just focus on the vaccine for a second. When people say, well, I don't want to get it, rather than trying to convince them, I've actually pivoted and asked a different question to them. I said, well, what's the advantage to you not to get it? Because I know what the advantage is for me to get it. And I could see what the advantage is when I administer it to another person. But what's the advantage to you if you were not to get the vaccine? It really puts a pause on that individual. And then they start trying to rationalize, and they start coming up with all these different things. And it gives me an opening to say, in the end, let me kind of explain why I think it's an advantage to get it now. Or let me explain what's the advantage not to wearing the mask, right? What's the advantage of not washing your hands? Right? I think everybody knows washing your hands is the right thing to do. I think the other thing to kind of highlight some other public health measures, always draw on other things people, you remember how we talked about trying to put comparison or just, put it in perspective. There's been little to no flu in this past year, simply because we were distant, we wore masks, and we practiced great hand hygiene. All right. The other thing that's not been circulating, which always hits our younger children, is RSV, the respiratory syncytial virus, especially the infants. Those cases have been also very small and have not impacted the inpatient census for a lot of the children's hospitals. Again, all due to simple public health measures.
I think that's a really great response, Dr. Mayorga. If I could also offer, Sarah, I think, ask the question, you can't force anyone to do anything, right? And all we can be, we heard about this in our media discussion with Dr. Mark Lieber, all we can be is conveyors of correct public health, correct health information. It's not necessarily our job to force anyone to do anything, even if we believe it to be in the best interest of a patient. We still took an oath to respect patients' autonomy. And so I think it's a really, really great approach that Mayorga is introducing to really just assess where that hesitancy comes from and what they perceive as benefits of not engaging in behavior. That's actually one of the steps that you engage in motivational interviewing too. Sarah also presented the question, how do you suggest we handle conversation about people believing that vaccines are, quote, satánicas? If I could translate kind of the devil's work, if you will.
Yeah, that's circulating a lot in certain, especially in Latin American countries. That's come up a bit. I think it goes back to really trying to, as best as one, asking why they think that and where they're getting that information from. I think I always draw on, a lot of folks get their education and learning from social media. And so, there's some very infamous, pictures now or cartoons coming out that someone's up late at night typing on the computer and they found the one thing that's wrong with the vaccine that no expert has found, right? So I think that's another perspective to look at is really understanding, one, why they think that, where they're getting their information from, and really again explaining, this there. I like to pivot slightly because again, this opens up another potential conversation that's difficult to have. But I always like to pivot when people bring in religion. I draw on religious leaders that have really put their stamp on, getting vaccinated or making sure people follow public health measures. We know that there's a lot of reservation across the use of certain vaccines due to the use of human embryos and things of that nature. But certain religious leaders have really come out and said, it is okay to get this vaccine because it's for the greater good of humanity. I mean, that's literally part of what the Pope said, not too long ago in his statement. So again, it's a difficult conversation to have because people come up with all these ideas, and it is a challenging one. Trust me, I've had some of these very challenging questions come to me live, out of the blue in these town halls, and having to answer them is again, takes some tact and sometimes difficult to answer.
Well, thank you for being with us today, Dr. Mayorga. We appreciate your perspective, pulling both from leadership and working on the ground and being a part of the very community that you're talking about. I think that you are well positioned in many ways to have given this talk today, and we appreciate you.
I appreciate being here, guys. I appreciate you guys listening. And at the end, you help me, right? I can't do this alone. And I advocate for every community as much as I can. And I appreciate you guys advocating for the communities as well. So thanks.